actually the fourth time out of five webinar initiatives that we are having Humanitarian Forum Indonesia, Asian Disaster Reduction and Response Network, Human Initiative, and International Council on Voluntary Agencies. Here with me are the remarkable speakers and then moderators and also the other organizers as well. And then we would like to welcome you all very warmly to this webinar. Hopefully, we can use this webinar as a room for dialogue within the CSOs in the region, particularly for us in the Asia Pacific region. So the topic for this webinar today, we choose a very interesting topic, which is maintaining accountability in humanitarian response during COVID-19 pandemic situation. What we will discuss, actually, we have a moderator coming from Plan International, Mr. Angelo Malencio. You can also see his video if you turn your Zoom view into gallery. And then we have Ms. Syama Mal from Community World Service Asia here with us. And then also Ms. Anastasia Mailinda from Yakum Emergency Unit from Indonesia. And then also will be joining us later, Dr. Ahmad Faisal Perdaus, President of Mercy Malaysia. So we will have a very interesting topic with them. And before we start, I would like to brief you a little bit about the Zoom webinar if you are not really familiar on how to use this Zoom webinar, because this is a little bit different with the Zoom meeting that maybe you guys are familiar with. So I will skip the quick guide for the panelists and jump into a quick guide for the attendees. For attendees, this is a very important thing you need to know, how to submit a question in the Q&A menu. So below at the bottom of your Zoom, you may see the Q&A menu. This is to see the all questions and answers during this webinar. So please see at the bottom of your Zoom, and then type your question or response in the box here, and click send to send your question. And then please mention to whom your question is addressed to, either to one of the panelists or to all panelists or some of the panelists. It's up to you. A straightforward question or response is more preferred, so please do so. Your question may get written response or answer by the panelists or by live by opening their mic. Yeah, like this, and then like this. You can also click thumb symbol to like or upvote any interesting question. And you can also respond or comment to some questions from other attendees like this. And how to interact with panelists and attendees through chat menu. Chat menu is used to interact with panelists and or attendees, such as say hi, etc., for informal communication. So we encourage you strongly to not use this menu for Q&A. How to use? Please click chat menu at the bottom of your Zoom. Like that. And then if you go to the to section at the bottom of your chat box, you have two options. Select all panelists if you want to interact with all panelists, or select all panelists and attendees if you want to interact with everybody in the Zoom. Yeah, like that. A bit of warning, attendees are not able to send chat only to one of panelists or attendees. So there will be only these two options provided in the Zoom webinar. And how to open your mic or unmute, or if you want to be allowed to talk during the discussion. Attendees are not able to open their own mic or unmute themselves and open your video. Yeah, this is something already set by the Zoom webinar. The organizers will open your mic or allow you to talk if there is any direction or request from the moderator or the MC. So please raise your hand to request to be allowed to speak or to open your mic or unmute yourself by clicking the symbol raise hand at the bottom of your Zoom. And if you are done speaking, please click lower hand at the bottom of your Zoom. Yeah. And also, we have two sign interpreters that you can also pin their videos for you who need sign interpretation. And we are also live in social media in Humanitarian Forum Indonesia and in ICFA's YouTube and also in Facebook of ADRN and Human Initiative. If you have trouble during this webinar on how to submit a question or anything else, please remind us or tell us in the chat box. And I also put the attended form link for all the panelists and attendees. Please fill out this attendance form. I will also remind you all regularly. Please do so because we need to record the who's already here in the Zoom webinar. So that's a little bit of briefing, and I'm seeing Dr. Faisal already joining us. A very good afternoon, Dr. Faisal. Can you please unmute yourself?
Good afternoon, good afternoon. Thank you very much. Thank you for having me. Thank you.
Great, thank you, Dr. Faisal, for joining us. So, yeah, we are welcoming you all, everybody, in this Zoom webinar. And then we are already done with the briefing, and I would like to hand over the floor to Dr. Ahmad Mani Dixit, Chairman of ADRN, to also warmly greet everybody in the Zoom and then also to say something to us for the opening of this webinar. Yeah. The time is yours, Dr. Ahmad.
Thank you very much, dear. It is. Thank you very much, and our friend Dr. Ahmad Faisal and Angelo and Shama and Melinda and all the participants, dear. It's really great. In this difficult time, we are organizing this seminar together with the HFI and ICFA and ADRN with a great inspiration from HI and also, you know, indirectly or directly with Malaysia. So it is such a wonderful coalition. This is, as dear said, this is the fourth of the 5 planned such webinars which are on topical points. So I welcome all of you. I greet all of you, the speakers, the participants, for joining in this seminar, and a special thanks to the partner organization for bringing the key lessons from ground to this meeting. Well, this Corona has brought about new challenges. Although ADRN, right? I mean, it has been quite long that we talked about accountability of our action or inaction, being responsible for things we do and justify and explain what we are doing. So this is the topic of today, to assure ourselves that whatever we are doing, we are accountable for, and we, you know, the management of our knowledge and information about accountability, it is not only, I mean, not only we perform that, but also it is being tested during this difficult time when people are suffering a lot, people and nations are suffering for a lot. How do we practice? How do we do things? And then identify what should be the changes, what should be what should be, how we should adjust, what should be the flexibility to be brought in into this entire process. So it's a learning opportunity also. Now I'm telling this because it's ADRRN is a, together with our so many partners, even those who are non-members of ADRRN, we are working together in collaboration, and then it is, we have commitments to support the impacted communities through various forms of support in this pandemic. I mean, ADRRN members, we did a survey, and it is such a encouraging thing to find that about 50% of our members are being funded, or they have been able to relocate their funds to be able to do this pandemic, address the pandemic issue. But there are about half of our membership who don't get so far no funding, but still they are in the process of with the community, working in wash, in hand washing, in providing soaps, providing food, providing medical treatment, providing helping the hospitals, and some of them, they belong to the hospital area also. For example, the Doctors for You of India and Dhaka community hospitals, they are members. So they are working wonderfully well. But where are the ways where we can improve our services? Where we have to be the example of accountability. We have the example of the standards and quality. So, as I said, this is the time when we have to learn, when we have to show our standards, when we have to, do the service in the best possible way, so that the people who are suffering, they get what they expect from us, the nation get from what they expect from us, be it the distribution of food, or be it the distribution of medical services. And in this process, I again want to say that this question of accountability was, we started thinking about long ago, and thanks to our CWSA, the community stuff, the CWSA, our member Community World Services Asia, they have a hub. It is one of the 7 hubs that ADRN operates, so as being, to decentralize the activities, and also to do innovation in our thinking, and to be closer to the community, and also enrich ourselves. So this accountability, this quality and accountability hub based in, which is Shama is leading that. So that is for ensuring that we all members, we know what is this quality and accountability measures and standards, and this hub continuously feeds us about what are the way to be doing things. So I maybe Shama will be talking more about the hub and its work, but then I would like to say to all the participants and others that this is an important issue, and ADRN has been thinking about that, and we have been constantly improving on the standards of our delivery, and being accountable, doing things, and being responsible for whatever we do, because there are problems. There are many problems. When starting from our psychology, we think that the disaster are the acts of God. This is fatalistic approach and fatalistic thinking, and that, sharing, rather than taking the accountability ourselves, we sometimes say, okay, it's a God's act, so I'm not responsible, and that is ingrained in our psyche, and we have to get rid of that. How do we do that? And the more we have used science and technology, the more we link people with the science and technology, what is happening in the research stations in terms of DRR, how it can be brought down to the people and every doorstep of the people in the last mile, or the first mile, as now it is said. So that is one thing. The other thing is that we ourselves to be learning much, and be ready to put ourselves in a inconvenient situation. For example, I mean, it is see the SETAC framework, it has reference to accountability, and this is what accountability is one of the nuances of the SETAC as compared to the HECO framework, is that it is emphasizing on the accountability part, and but still I don't find that there is much standard in terms of the metrics in terms of what should be the accountability and thing, and that's what our hobby is doing. So with this, I welcome you all. I thank all the partnering organizations to have organized this webinar. I thank Dr. Faisal to have given his time, and also Angelo and other speakers and all the participants. Please take part. Let's be very, not very formal, let's be informal, and more questions, more discussions. And thank you, dear, for organizing. I know that you are the epicenter of this webinar series of webinar. ESI has been doing wonderful job keeping the lamp burning. So thank you very much, and wish you all the best. Thank you. Over to you, dear.
Thank you very much, Dr. Ahmad, for very warm remarks. And for the attendees, if you wish to know more about Quality and Accountability Hub of ADRN, please do visit their website, www.adrn.net, for more information. So I would like to hand over to Chairman of Humanitarian Forum Indonesia, Mr. M. Ali Yusuf, for conveying his warm welcome remarks to you all, and then a little bit of something that he would like to share. Over to you, Mas Ali.
Yeah, thank you, dear. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. The Honorable Dr. Ahmad Manidiksit and Takashi Komeno from ADRN, Christian Benedum from ICFA, Mas Kaimudin from Human Initiative, all speakers, Dr. Faisal, Sama, and Mbak Linda, Moderator Angelo Malencio, my colleagues in the Secretariat of HFI, and all participants. Greeting from Jakarta. I hope everybody here is safe and healthy. First of all, on behalf of Humanitarian Forum Indonesia, I would like to express my appreciation to all parties for supporting this webinar, especially ASEAN Disaster and Response Network, International Council of Voluntary Agencies, and also Human Initiative. This is the fourth webinar out of our webinar series on GSO role and its sustainability in the new normal age. And today, we will discuss a very interesting topic, maintaining accountability in humanitarian response during a COVID-19 pandemic situation. As we know, accountability has become a key action to ensure effectiveness and efficiency of our activities. By having an accountability mechanism, it can monitor how the community as target beneficiaries gain the real benefit from our services. Accountability is a continuous process from the activity started until it is finished. Accountability is not only about responsibility for donors, but more than that for the community as beneficiaries. And accountability is not only about what we report to the community, but also what the community can convey the responses and their voices. Humanitarian Forum Indonesia, or HFI, is a forum of humanitarian organizations in Indonesia. We were established in 2008, and currently we have 18 organizations joining us in the membership. In 2010, we have compiled and published a guidebook on accountability in providing humanitarian assistance as one of reference guidances for humanitarian organizations, particularly members of HFI. However, at this COVID-19 pandemic situation, accountability will become a challenge due to changing situation, and this situation may be the first time for some people to deal with the new habits and multi-hazards. In Indonesia, we are also still adapting the new habits with tight health protocols. Despite also we are still doing emergency responses. It also affects the way we work and re-strategizing our sustainability plan. I'm sure from this webinar, we will obtain a lot of inspirations and also lesson learned how to maintain accountability of our response activities in a COVID-19 pandemic situation. At last, I wish you all have a good discussion and be inspired one another. Thank you all. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone.
Thank you very much, Mas Ali, for very warm welcome remarks for us all, and wish you to stay with us here until the end of the webinar. It would be great to have you here in the discussion as well. So I would like to introduce you to the moderator that will lead us into the very interesting discussion. Please let me introduce him. He is the Regional Preparedness and Response Specialist of Plan International, and he is also known as a remarkable core humanitarian standards trainer. So please welcome Angelo Malencio from Plan International. He will lead us into discussion with all three speakers that we have. And for attendees, if you have a question or a response, please also use your Q&A menu at the bottom of your Zoom. The floor and the time is yours, Angelo.
Thank you, dear. I will refrain from turning on my videos. I think my internet connection is poor, but later before the end, I will turn it on. So welcome to the webinar on maintaining accountability in humanitarian response during pandemic. Before we begin our talk show, I'd like to request our esteemed speakers to introduce themselves. So perhaps HFI can show their profiles so they can introduce themselves one by one on the share screen.
We will, Angelo. So we will start from Ms. Syama from CWSA. My colleague will share the screen.
Okay, thank you. Thank you, Angelo and dear. Hello, everyone. My name is Shama Mal, and I work with the Community World Service Asia, and I'm based in Karachi, Pakistan. So I manage CWSA's humanitarian development programming portfolio in Asia, as well as some of the support functions of the organization. So I support the organization in organizational development, visibility, and fundraising. And I'm involved in designing strategies and approaches to promote quality and accountability within our organization through mainstreaming to ensure accountability to the communities we work with, as well as for the broader sector from the Q&A Hub platform. And of course, also in a collaboration with Sphere and the CHS. So I'm very thankful to the Humanitarian Forum Indonesia and the rest of the organizers for giving the opportunity to share my experiences today. So I'd like to briefly introduce our organization. Dear, would you be able to put up the slides, please? Thank you. So Community World Service Asia is a humanitarian and development organization registered in Pakistan, headquartered in Karachi, and implementing initiatives throughout Asia. So we aim to address factors that divide people by promoting inclusiveness, shared values, diversity, and interdependence. Our program partners include communities, local and international partners, the government, academia, networks, and alliances. Next slide, please. Yeah. So CWSA works on about 7 different thematic areas, which include climate action and risk reduction, livelihoods, health, education, quality and accountability, emergencies, equality, inclusion, and participation. So in 2019, we assisted about 7 million people across Asia. Next slide, please. Oh, this is the right slide. So we're committed to promoting quality and accountability within our organization, with the communities we work with, and also by supporting the wider humanitarian and development sector in Asia. So we're a member of the CHS Alliance and Sphere, We're the regional partner to Sphere in Asia as well, and also country focal point in Pakistan. We're also carrying out the focal point role for the ADR and Q&A hub, as mentioned by Dr. Dixit as well. So as Dr. Dixit highlighted the role about the Q&A hub, it's playing in quality and accountability. Since COVID-19 started, just to mention that the operation challenges around it, we have been focusing on supporting organizations in the region, more so on experience sharing, best practices, guidance, and tools on various aspects of Q&A through the webinars that we've been doing. So over the last few months since COVID started, we've reached out to about 2,000 practitioners from the humanitarian and development sector in Asia. So resources from these different initiatives from the Q&A hub can be found on our website as well as on the ADRN website. So thank you very much. That was just a brief introduction.
Thank you very much, Shama. And sorry, my connection got cut earlier. Which one would be the next to introduce? I think HFI should be able to share the profile.
Yes,
Maybe
Angelo.
Miss Anastasia.
Yeah. Please
Thanks.
introduce yourself, Miss Linda from WU.
Thank you, dear and Angelo. I would like to introduce myself. I'm Anastasia Melinda Titilestari. I'm the Manager for Information and Communication in Yakum Emergency Unit. I've been in the organization since 2006, and I've been working in several emergencies in Indonesia. And the last one is in the Central Sulawesi response, as I was appointed as the response manager at that time. And based on our experience from the previous projects, we know that accountability is key in our organization operation. And we also become member of HUB, Humanitarian Accountability Partnership, back in 2015. And now we are also member of CSS Alliance. And we've been through in different discussions with CSS Alliance since then, and we also try to incorporate the accountability standards in our organizations. So if I may share the screen, or there, will you share the organization presentation?
Yeah, we are sharing the screen now, Melinda. Okay, there you go.
Thank you. Maybe you can just jump into the next slide. Yeah, thank you. So Yakum Emergency Unit is one of the units under Yakum. Yakum is the Christian Foundation for Public Health. For Yakum Emergency itself, we established in 2001, and we have worked in different emergency settings in Indonesia and also in region. And we have 3 strategic plans that we will review every 5 years. And basically, the first strategic plan, sorry, can you return to the previous slide there? Yeah, thank you. So for the first strategic plan, it's on the increasing of the capacity of the communities in disaster-prone areas, means that we focus on how to provide efficient humanitarian assistance during emergencies. And for the second strategic plan, we try to focus on the resilience building of the community, on how to improve the quality of program and community resilience. And we are not only working on the disaster response, disaster risk reductions, but also on the climate change adaptation as well. And the third strategic plan will be on how we as an organization become an independent and a transformational institution. And accountability is also part of this strategic plan also, on how to develop our organization into a quality organization in the humanitarian settings. And the next slide. Hello. Okay. The next slide, it shows only the showcase of what we have done so far since 2001 and 2020, where we work and what types of emergency we have responding to. And we basically provided interventions in different sectors. The health service and the hygiene and sanitation is also key in almost all of our interventions. We also work for the shelter management, protection, psychosocial support, and the livelihood interventions as well. Next slide, please. Okay, next. Maybe we can jump into the next slide. Okay, so basically on the response to the COVID-19 response, it is not YEU as a single entity who worked in the response, but we work jointly with the other YAKUM units and especially with the YAKUM hospitals who are becoming the front line in the pandemic response. And this is just to show you information about our capacity in responding to COVID-19, especially in the hospital or our medical unit. Next slide, please. And apart from the hospital interventions, we also have inclusive community resilience, where we also work hand in hand with the hospitals. So there are 6 areas in Indonesia that we are working currently in 6 provinces and with different interventions as well. And so far we have provided interventions for more than 90,000 beneficiaries across Indonesia. Thank you, Dea. Over to you.
Thank you very much, Melinda, for the introduction to YAKUM Emergency Unit. And next, we have Dr. Faisal, who will introduce Mercy Malaysia. Over to you, Dr. Faisal.
Hello, Assalamu alaikum. Very good afternoon. Thank you very much, first of all, on behalf of Mercy Malaysia and myself, for inviting us to be together with you in this webinar today. Mercy Malaysia, as always, is very happy to participate in any collaboration and in any information sharing and learning event. Firstly, just a small bit about myself. I'm Faisal. I am president of Mercy Malaysia. We are a multifaceted humanitarian aid organization with a few focus areas. We began as mainly a medical-based, health-based humanitarian aid organization, but we've now also diversified very much into other areas as well. Health, however, remains our main focus. And therefore, of course, with COVID-19, Mercy Malaysia is actively involved in both the response, preparedness, as well as mitigation aspects of this pandemic. For this pandemic per se, Mercy Malaysia is working mostly in Malaysia. And I must say this is the first time perhaps that where a global crisis or even a regional one is concerned, that Mercy Malaysia is working more in Malaysia than outside of Malaysia. Malaysia has been very fortunate as a country that it is spared from most major natural calamities, and for the last 40 years or so, we've not had a major domestic armed crisis as well. So most of our work over the last 21 years or so of Mercy Malaysia having been formed has been outside of Malaysia internationally, especially in Asia. But this time, where COVID-19 is concerned, most of our work is actually in Malaysia, with a little bit of focus in neighboring countries. With regards to our focus in COVID-19, we are working mainly in the health sector, of course. And we have operations both in response and preparedness in health. as well as in specifically a very big participation in mental health and psychosocial support programming in Malaysia. And we also have community and community-based resilience to the pandemic programs. This comes naturally to us because in our disaster risk reduction work, we've also evolved from being just DRR focused to also building resilient communities. And this has been a focus, community resilience has been a focus of Mercy Malaysia since 2016, since after the World Humanitarian Summit. And so working on community resilience in this pandemic comes as second nature to us, as I said, and it also it provides us with another avenue for more sustainable community development especially in targeted communities, in vulnerable communities, among the poor, etc. Apart from that, I would say that Mercy Malaysia's other relevant points that perhaps in this introduction I'd like to bring up is our commitment to accountability. We were one of the very first organizations, not the first, but one of the first few organizations who committed to HAP when it was first found more than 13 years ago now. Yeah, and of course HAP is no longer there, and we were certified by HAP twice. And we have since, of course, also now become a partner of CHS. We are now a full member of Sphere, and we remain committed to the humanitarian principles in many other forums. We're also a very networked organization. We are a founding member of ADRRN, as well as other networks. In ASEAN, in the ASEAN region, we are a member of the ADMIR APG group, and we're also a partner of AHA Center. And at the global level, Mercy Malaysia is a member of many networks. The foremost, I would say, would have to be ICVA, and we're very proud to be a member of ICVA, and we believe that networking and sharing is the way to go for humanitarian organizations, regardless of whether we're from the north or the south. So with that, I would like to again thank the organizers, especially Humanitarian Forum Indonesia, ICVA, and other ADRRN and other partners for making this webinar possible. Thank you.
Thank you very much, Dr. Faisal, for your introduction to Mercy Malaysia's great work, particularly in the COVID-19 pandemic situation. Unfortunately, we don't have Angelo here, but I will try to guide us into the discussion. So, ladies and gentlemen, prior to the webinar, we've given all the three speakers key questions that they will answer. So the first question, I would like to ask, how tangible is the impact of the pandemic on CSOs, particularly in your organization, in providing information and project knowledge to the community? So I would like to give the first opportunity to Shama to answer the first question. Over to you, Shama.
Thank you, dear. Yeah, so one of the ways we demonstrate accountability towards people we assist is through information sharing. The Core Humanitarian Standard, or the CHS, it also places emphasis on this through commitment number 4. So this pandemic has had a far-reaching impact on CSOs and communities we work with, including our ability to operate, access people, and communicate with them effectively. Our sector wasn't prepared for something of this nature and scale. So traditionally, for any large emergency, our response mechanism has mostly been to scale up, do rapid deployments, pre-position, be on the ground within 24 hours. So our interaction and engagement with the communities has always been based on a physical presence in the field, cultivating local relationships with communities, coordinating with the local government and line departments, and other local organizations. All this came to a halt for a while when COVID-19 hit, and we had to go into lockdown and figure out how to continue to work remotely. So one of the priorities for CWSA was to communicate information about COVID-19 as well as the rights and entitlements to the communities we work with in Afghanistan and Pakistan particularly, who mostly belong to remote rural areas. So our communication at the time was initially all done remotely through the use of mobile phones with focal people at the community level. One challenge was ensuring information reached people at a particular disadvantage in accessing information, such as women, children, minorities, people with disabilities, as they often don't have access to things like mobile phones. So we experienced during COVID-19 that the gap between those who had access to information and those that didn't have access grew significantly, putting those without access to information at greater risk. Information sharing is a two-way process. It also gives communities the opportunity to share information with us as well. So understanding the concerns and needs of different groups of people is important, so that our interventions are designed around specific needs. So we tried to widen our access and also local ownership of the interventions by engaging community structures like focal persons, teachers, religious leaders, local staff from the communities who helped us in disseminating information further in their villages. We've invested in many of these kinds of community structures over the past many years. It was also hard to help people understand the implications of COVID-19. In our context, communities have so many struggles on a day-to-day basis that the risk of COVID-19 is relatively insignificant to them compared to where and how to get the next meal for their family. So the perception of risk is different for various communities and contexts. What we perceive as a risk for them might not necessarily be so in their eyes. So information sharing needs to involve listening to, and if possible, addressing the concerns and needs of the communities, supporting them in making informed choices and decisions, and local organizations as well as community structures are a better place to achieve this. Consequently, most of our COVID-19 response work focused on livelihoods and mobile cash distributions besides health. I think the pandemic also put some NGOs or local organizations in a very difficult position of communicating certain difficult decisions to communities. Some partners and donors suspended ongoing projects, in some cases at less than 24 hours notice, to redirect funds for their own needs, depriving local communities from life-saving services at a time when they needed it most. This behavior undermines the principles of partnership and accountability by putting own needs before the needs of affected people without due consultation or a dignified exit process. So NGOs and local organizations who experience this were left in a very difficult position and has really put their credibility to test with local communities. On the other hand, some partners and donors demonstrated a lot of flexibility by allowing NGOs like us to re-strategize and readapt existing projects or use reserve funds to meet the needs of the people affected by COVID-19, or even just maintain communication and moral support throughout, regardless of funding support. So just to conclude, we tried to overcome some of the challenges of engaging with communities and information sharing by using bottom-up approaches. Local organizations understand the local context better and have good relationships with local communities. Thank you.
Thank you very much, Shama. From your explanation, I have some questions that will be interesting to elaborate with. But before that, I would like to pass on the same question to Melinda as well. From your perspective, how would you like to answer the first question? Melinda, over to you.
Thank you, Dea. So basically what we are doing in Yakum as a Christian Foundation for Public Health and also as YEU, whose mandate is on the humanitarian response, we see it from our experiences and also practices during this pandemic. And that also because in responding to COVID-19, we work closely in 180 communities in 6 provinces in Indonesia through direct implementation program and in partnership with local partners in villages and also village government. So based on that, we also know some context or the local context that we need with regard to on what are the impacts of the pandemics in our organization in providing information to the community. And basically, since our project is mainly in some of our project mainly focus on the inclusion on how to address the need and also the rights of high risk communities and also vulnerable groups, we saw that there are evidences of the gaps in the COVID-19 response so far, which threaten to leave persons with disabilities even further behind. So I think this is nothing new for persons with disabilities, older people, and other vulnerable groups, uh, especially in this kind of situation when they are disproportionately affected by conflicts and emergency situations. So this is just to show you statistics that persons with disability represent over 15% of the world population, and also the older people make up 9% of the global population. So we need to think of them also in our interventions. So as many countries experienced, and also as Shama already shared, that during the first months of the pandemic in Indonesia, public services like health services, education, and economic were at halt. And for vulnerable groups such as the older people, people with disability, and other vulnerable groups, this means problem to access the information, because most of them access the information in a conventional way through face-to-face. They're also afraid to go to the health facilities for fear of the virus transmission. So, for example, the older people in Indonesia, they usually got information about health status and the other thing during the Posyandu activity. Posyandu means the integrated health service in the sub-village or sometimes in the village level. Usually they got the information through through this kind of services. And people with disabilities who have mobility issue and stay most of the time at their home, they get information basically during the home visit by the health gatherers, the village health gatherers. So when the services stop, access to information is also cut off. So this is a big problem for them also. And how YEU identify what kind of means of communications of methods which is suitable for delivering information for the specific groups that I already mentioned is that we first identify and through the direct observation or online and basically we want to know what means of communication which is suitable for them. So the results showed that for example, the elderly, they are more accustomed to accessing information from radio and television. It's more one-way communication. And people with visual impairment needs more specific tools with regard to the audio form information. And people with hearing impairments, they need the sign language when attending online meetings and the other things. And people living in rural areas, because they have limited telephone signal, they still prefer to use flyers, poster, and banners. And that's why we need to identify first what are the means of communications available at place and which is suitable for them. So after the identification process, the team will proceed with the orientation to the communities, government, and stakeholders while using the preferred media for specific activities or specific purposes. So for illustration, we have the voucher assistance program to the village community, and they prefer flyers to inform the project delivery and also the flow chart on how to use the vouchers and other things. And we also provide psychosocial assistance through online counseling session. Uh, we come up with this idea after we learned that most people will feel safe and secure where they have the online counseling session. So we designed the online counseling session particularly to health workers, medical personnel, and families with elderly and persons with disability using the designated hotline number. So apart from the observation and the assessment that we have, we also seek for any relevant reference on how to quickly adjust our information sharing methods. So in this case, we need to find ways on how to find the proper information guideline for those specific groups. So it becomes more apparent to us that the identification process, as I earlier mentioned, continued to develop into a more accessible information and communication guidelines for different types of disabilities and for different types of groups. So I think that's what we want to share with regard to the on how the organization or YEU or YAKU is providing information and project knowledge to the community currently, especially to the especially in addressing the vulnerable groups. Thank you, Dea. Over to you.
Thank you very much, Belinda, for elaborating on this first question. I think I learned a lot on how Yakum Emergency Unit dealing with the new methods of sharing information, especially because you guys serve a very vulnerable group, which is elderly and disabled group. We would like to back on that, but I would like to pass on the same question to Dr. Faisal. Please share your experience on how you deal with the first question. Over to you, Dr. Faisal.
Thank you, dear. I'll be brief. I don't want to repeat what my colleagues have just mentioned. I agree with most of what have been said. I particularly also agree and like what was said by Shama earlier, which is we are in danger actually of not fulfilling our duty in accountability to beneficiaries in this pandemic, because basically because the pandemic has been so sudden and so big in its impact. Yes. So briefly, I think definitely there has been a tangible impact on NGOs, on CSOs, and on communities as well. Yeah, and the impact has been both in the provision of information, but as well as ensuring that the information and the knowledge that we provide is understood in the right way by the affected communities. So these are slightly different challenges. So we not only have to have the correct strategy, we also have to have the correct method. And of course, when we talk about marginalized populations, as my colleagues have mentioned, patients with disability, patients who are targeted because of their gender or orientation, people with other forms of difficulties like migrant workers, like refugees, both of whom we have in Malaysia, then the challenge becomes multiplied. Yeah, so there is that challenge of both providing the information, but also getting them to understand the correct way. And of course, while doing that, we have to ensure, just like I said just now, philosophically, that we maintain our promise and our premise as accountable humanitarian organizations to actually put accountability to beneficiaries at the forefront. We must ask them first. And as Shama pointed out, to some people, what is the first priority or the most important thing may not be the same as how we perceive it. And sometimes putting food on the table is more important than the virus to some people. And this is something which we have to actually acknowledge and not ignore. So this is on our part. And of course, that means that we have to have the correct material. We have to have the correct plans and strategies. We also have to use the right kind of language. And on top of all that, I put it to all of us also that we will have to train our own people, and we'll have to put the right kind of right kind of personnel, either staff or volunteers, to do this providing of information, so that it will be accepted and it will be internalized. One of the problems that we have in all of this information sharing during this pandemic is internalizing all this information, and part of it has to do, we must admit, with the deluge and the amount of information that's available and that's coming in. It's so much, and so it's probably the job of civil society organizations like all of us to actually partake in some of this correct synthesizing and disseminating of the correct information in the correct way. So that also means that we have to produce the right kind of information, education, and communication materials, be they in the paper form, in hard copy, or online or soft copy, depending on the population and the target vulnerable people that we are looking at. The third thing is, of course, while doing all this, we also have to consider localizing the communication as much as possible. Malaysia being a diverse country, racially, as well as by religion and by faith, we have that mix already. Compounding that, we also have migrant workers who, at one point in the pandemic, were a large number or large percentage of those who were getting infected, although most of the infection was contained within their own community. Now, at present, we're witnessing the equivalent to the global second wave, but in our country, the health authorities have called it the third wave of infections, and a spike in a state that is further away from the center, in Sabah. And there, the ethnic and language composition in that state is vastly different from the rest of the country, if you take into account especially the vulnerable populations and the poor. And this is where the challenge in giving out the information is. We need to localize the information as well. We talk a lot about localization since the World Humanitarian Summit. But I guess one of the things that all of us need to realize is also sometimes that we need to localize further, even within our own countries and within our own regions. So this is perhaps another point that I would like to make as an addition that my colleagues have not yet mentioned. And my last two very brief points, of course, all this has to be coordinated and done in a systematic manner, and that means it not only involves our own organization, whoever we are, it also involves others and the national or regional or local coordinating mechanism, including government agencies, etc. But it also means that it should also involve the local communities directly. And here perhaps is where localizing the communication becomes very, very critical. And Mercy Malaysia sometimes uses local champions, people who are within the community, who then help to disseminate the information and the communication within that particular affected vulnerable population, be they refugees, be they a minority ethnic group in Sabah, be they migrant workers, be they the very poor, etc. Thank you very much, dear. I'll stop there for now.
Thank you, Dr. Faisal. Wow, I get a lot from your explanation and elaboration earlier. I noted down that you mentioned about training your own people. You have to choose the right kind of personnel. And then I like the idea also to have the localizing of communication as much as possible, and then how we can present local champions to disseminate the information and communication. But I will be back on that later. Before jumping into the second key question, I would like to have a chit chat with you, the speakers. First of all, with Shama, you mentioned that you were left unnoticed by the donors. Your donors stopping their funding support for your organization. And I would like to know, how do you deal with that, and how do you communicate this unfortunate event with the community or beneficiaries that you serve? Over to you, Shama.
Hi, thanks, dear. Yes, I mean, it's a very difficult question to answer, because we've experienced this ourselves, and we've heard, other organizations experiencing this as well. I think particularly it's gets even more difficult when we've been working on ongoing commitments, ongoing projects for a longer period of time, where you've built that relationship with communities. So it gets very difficult. So, when projects are suspended in that way without consultation, I think we understand that sometimes the reality, especially now in COVID, where funding is dwindling, and a lot of organizations and donors started thinking about their own sustainability and future, and started saving funds or saving resources for their own, future to sustain themselves. But I think at least the least they can do is to have some sort of consultation and a graceful exit, and give time to communicate these with the communities. But in our experience, that didn't really happen. So it got very, very difficult with communities at a time when they needed all this support. One of the incidences involved like an ongoing health program. So at a time where COVID is affecting people, and then their ongoing support on health, especially for women and children, that is also withdrawn from them, it becomes very difficult. But fortunately, I mean, we tried our best. We have these community structures in place. In the case of like a health project, we have health management committees. So we communicated the situation as best as possible to them. It is very hard for them to understand all these challenges, and the challenges even donors and partners face. But I mean, we just try our best to communicate it to them, and try to work out ways of how we can continue some level of support by engaging with the local government, local departments to some extent, and find out how to exit or how to sustain it, or maybe even hand over certain projects to other actors who are in a better position to do it. So, I mean, there's no easy way to communicate something like that at the community level. So I don't know if that answers your question, but I think the other thing I want to emphasize is that, when issues like that are communicated to organizations like us, the communication channels should be left open. But if something is communicated and then all communication channels are closed, where we can't even protest or even, understand why or what other alternatives we can come up, that also puts us in a very difficult position. And it really questions this whole issue of accountability. Then how accountable are our partners and donors when it comes to something like this? Because sometimes I think if we can consult and discuss things, we can work out better solutions. But just announcing something and then, closing all communication channels is not the right approach, in my opinion.
Yeah. So thank you for sharing, Shama. I know that it will be not easy for you guys to to the community. I would like to ask Dr. Faisal if you have same experience as well on by your donor, if your donor suddenly stop their funding support to MERS in Malaysia, or even not really like stopping, but they cancel some of item in your budget, for example. How do you deal with that, and how do you communicate with beneficiaries that you serve? Over to you, Dr. Faisal.
Okay. First of all, I'd like to say I must agree with Sharma that that NGOs, CSOs as a whole should come. I think one solution would be for NGOs to come together, and that would only mean for us to work through networks. I think while every NGO should approach their donors to actually communicate that that they should not, if possible, cut budget for ongoing programs, but also to communicate if they really have to communicate in time, in a timely manner, and also to ensure handover to another organization perhaps is possible. But apart from that, I think solitary NGOs on our own, trying to do that all the time may be a bit challenging, especially in this current situation. And I have, before this in other forums, also suggested that perhaps that's the role of networks like ADRRN, like especially networks like IGVA, which advocates for NGOs and NGO space, etc., to actually talk to donors and have them understand that it's not only because we want to continue the programs, but because they are actually beneficiaries already targeted and already ready to receive aid, and would be deprived of the aid that we had already planned for should they cut the budget allocation. Now, the second thing, of course, is on a bigger picture. I think NGOs should come together, and again, this is the role of networks mainly, but also of NGOs within countries and forums like the Humanitarian Forum Indonesia, to actually advocate to donors both international and within a country that the COVID-19 pandemic is a grave challenge, not just to the humanitarian sector, but to everyone, to all sectors, to all economic sectors, for example. But that other calamities and that other disasters and other man-made issues as well don't suddenly stop because there is a pandemic. Yeah, flights have stopped for the main part. Yeah, we have less international flights now. But apart from that, conflicts, for example, are still going on, and we have an example, of course, in Nagorno-Karabakh, away, perhaps further away from our region, but still, it exemplifies how other problems continue in the world. And so, major donors, and then through them, major civil society organizations, major UN agencies should be cognizant of the fact that while COVID-19 is an important and, of course, the most important challenge we have at present, other problems are going to continue. And in our region itself, in Southeast Asia and South Asia, if I might add both regions together, of course, the threat of natural disasters is always there. And I've already mentioned at a couple of other forums that all it takes is for one major natural calamity disaster to occur, either in South Asia or in Southeast Asia, for us to be in a big bind, not just because operations will become more difficult because of the COVID-19 pandemic, but because funding will be more difficult. And it will be wise, perhaps, for donors and for member countries of member state networks like ASEAN, like SAARC, to actually prepare contingency funds should there be any natural calamities, hopefully not, while the pandemic is still raging. Thank you very much, dear.
Thank you, Dr. Faisal. I would like to let Belinda to answer the same question because I'm aware that you serve a very specific beneficiary, very vulnerable groups of elderly and disabilities. So if you have same experience like Shama and her organization, please share.
Thank you, dear. So basically what we as an organization do is, first, when we heard the news about this pandemic, is that this looks like a blank canvas to us because we don't know what COVID is and how to address and how to respond to it properly. So basically we are as an organization, we are learning by doing of what we should do during this time. So I think this is also a difficult time for us because as the previous speaker said, that it also hit hard on the organization, where we should rethink again about our focus of interventions and how we can adjust accordingly on how we work in the community in particular, and how we also discuss with the donors or the donor partners on how we should adjust the situation accordingly with the context that we have in Indonesia. So it is of course a challenging situation for us as an organization because we need to recalibrate our focus and also on how we can work with the existing network, either in the national level or in the grassroots level, on how to address this. And of course, we are already in different discourse and also discussion in different levels. And we also share the importance on how to address the vulnerable groups, even in disaster, even in the pandemic situation. So we it is also a way of how we advocate, or how we make a collective voice within the network, on how to raise concerns, on how to address issues with regard to the vulnerable, on how to address the need of the vulnerable groups during the pandemic situation. So I think, yeah, I think that's all that I can share to you, there, and I think we can. Hello.
Yes.
Okay. Yeah.
Thank you, Belinda. You
Yeah.
mentioned the same thing as Dr. Faisal has mentioned earlier on how to advocate within the network. I think that's the use of us being in the same network or in the cluster, for example, how we can respond effectively and advocate something that we need to do as CSOs. So I'll stop there with the chit chat, but I have one question that's very, very interesting because Shama earlier mentioned about community's needs. So I would like to know your perspective on how to ensure that you get the actual needs from the community. But your move is limited, or you serve a very vulnerable group that is who is not really familiar with technology per se. How would you like to respond to that? I think I'll go with Dr. Faisal first.
Right. Thank you, dear. In our operations in COVID-19, that would currently apply to the refugees whom we have in Malaysia. The migrant workers, not so much, because they are quite savvy, to be honest, with smartphones, etc. The problems will be very much with the refugees, because and especially refugee families. So this is where, in our setting at least, we work very closely with UNHCR, as well as with luckily in our setting in Malaysia, we the refugee community, mainly the Rohingya refugee community, have got some form of organization or associations within their community as well. So what we do is we work with and we work through these refugee community associations, if you like, to reach refugee families, especially the family members who may not have any work, who may not have any education, etc., and who may not have access to information and to technology. Another example currently that we're facing, although most of it is being faced by local NGOs, local to the locality, is that on the east coast of the state of Sabah, which is actually nearer to the Philippines than it is to KL, there are communities who are isolated, who have not been able to receive aid and have not also been registered with the central authorities or state authorities, simply because they are in outlying areas and in isolated locations. So here again, what we find most useful is to work with local community organizations. When I say that, I mean really local, meaning they are organizations at the locality itself. And so they actually have a lot more connectivity with the affected population, and they are able to actually directly communicate with them. And that's how we then get information, get data, and share information. Otherwise, as you rightly pointed out, it will be very difficult for us because we don't get what they need, and we don't get the information that we need to help them. So yes, so that's how we do it. Thank you.
Thank you, Dr. Faisal. I think because Balinda earlier has already answered this question, so I would like to go to Shama. How do you ensure that you get the actual needs from the community when your move is limited, or when you are serving the community that is not really familiar with technology? Over to you, Shama.
Thank you, dear. I'm unable to turn my video on. I think it's been turned off by the host, which is fine, but just mentioning. Yeah. I think, like Dr. Faisal mentioned, you know, having good connections with local. Sorry, I'm just turning my video on. Yeah. So having good communication and engagement via these community groups or community structures, very local level organization is key. So I think in COVID-19, our experience was that it was even harder to access and understand the needs of particular groups. Like, for example, if we take even women, and I know there are even more disadvantaged groups, a lot of our work was around mobile cash transfers involving technology. And for that, even people have to have certain requirements in place in terms of their registration and ID and things like that. And in rural areas, women in particular don't have this kind of documentation and paperwork. In Afghanistan, we're working with the returnees. And for them, especially women, it's even more challenging there where they don't have this kind of documentation. So we were working very closely with these local community groups. We didn't want, especially these kind of groups of people and women, to miss out on opportunities in terms of some of the support and assistance they could get from organizations like us. So we worked with these local groups and tried to work out ways where they could access some of this assistance. So whether that was through these community groups, like transfers taking place through them to designated focal groups or focal people. So we worked out those kind of ways. And then also, I think, working with the local government in terms of understanding needs, working very close with the local government to find out what the needs are. Because the government, like in Pakistan, they also carried out a cash grants program for about 12 million families in Pakistan. So we also didn't want to duplicate that. We wanted to support it, but not duplicate. So getting information from them also on needs, and also people who require certain support. So we've been working closely with them. Also, like Dr. Faisal was mentioning, the role of networks. So when it comes to carrying out a response and understanding needs, here again, coordination with local networks and local organizations is key. So for example, doing joint needs assessments. If somebody already has data and information, there's no need to reinvent the wheel and duplicate something. So there is a lot of information available, and if we coordinate and communicate with each other effectively, we can. And then I think the most important thing is listening to people. When you listen to people, like I was saying earlier, that information sharing and communication, it needs to be a two-way process, where we're also giving space to listen to people and understand what they're saying and what their needs are. And I think it's important to meet those needs, because if those needs remain unfulfilled and we're trying to promote something else that we think they need, it doesn't really work that way. So yeah, I hope that answers your question.
Yes, it does. Thank you very much, Shama. Let's move on to the second key question. What approaches or methods are practiced by CSOs, in this case, your organization, in maintaining accountability for program intervention to reduce negative impacts on the community? Because you already turned on your video, Shama, so over to you to answer.
So I'll take the dive first.
Yeah, please.
So I think as an organization, it's important to understand and analyze the type of negative impacts we can cause through our interventions, and strategize on how to avoid or minimize them as much as possible. So in context of COVID-19, some of the negative impacts we wanted to avoid was any compromise on people's safety, their dignity and their rights. Of course, there are several other things also, but these were some of the key ones. some of the quality and accountability standards like SPHERE, the core humanitarian standard, some of the code of conducts we follow, and even the do no harm approach, they help ensure that our interventions avoid negative impact and are people-centered. So commitment 3 of the CHS, for instance, it helps us reduce negative effects of humanitarian response and strengthen local capacities. So we have mainstreamed these standards across our policies and practices in our organization. SPHERE and the CHS Alliance also actually released COVID-specific guidance for organization when the pandemic started, which are very helpful. COVID-19 has certainly reminded us about the importance of people-centered approaches. I think Melinda and Dr. Faisal also touched upon this already. During lockdown, when we were managing our project remotely, we were almost entirely relying on the support of community structures. So, I mean, why not in relatively normal times as well? However, it is important, I think, for me to also mention that such structures need to be inclusive, that women, people with disabilities, the elderly, and other marginalized groups are well represented in these groups. And not just represented, but are also involved in decision making. I think that is key. And it links back to the needs as well. It is important, though, to be aware that there are power imbalances within the community as well. And with remote management of projects, there is higher risk of personal interests and even exploitation of people by some of their own community members, which can result in negative impacts of an intervention that weren't intended. And last but not least, I think the complaints response mechanism enables communities to hold us to account and also alert us to any negative impact. So we use the CHS guidance again to set up and manage our CRM. It's very comprehensive. You'll see me referring to the standards again and again, but that's because we're from the Q&A hub. However, in our experience, lockdown limited people's access to share complaints, as we could only maintain one channel initially, which was via phone. And like I said earlier, certain groups of people, they don't have access to phones. And some people just simply don't reside in coverage areas. So we tried to mitigate the situation again by involving village committees to take a more proactive role in getting the message out to a wider group of people, and also take responsibility to communicate some of the complaints back to us. We also started using the same mobile number for remote monitoring and verification processes of our interventions. So we found that by doing it this way, community members saved and remembered our complaint response mechanism mobile number, and it was easier for them to get in touch with us and share any feedback or complaint. Secondly, we also try to strengthen our messaging on CRM by ensuring multiple sources of dissemination of key messages. So we utilize not only our project field teams, but also our monitoring team. And in some places, we also utilize the use of a text messaging service. I think that maintaining a CRM is challenging at the best of times, and our sector needs to do much more to improve it. Verification data from the CHS Alliance members collectively indicates that our performance on commitment number 5 on the CRM needs much more improvement. This has been highlighted in the Humanitarian Accountability Report of 2020 that was recently launched by the CHS Alliance. And I think another important thing is that communities still hesitate to launch or lodge complaints on more sensitive and serious issues, such as sexual exploitation and abuse, as evident from the most recent case from the DRC, where journalists uncovered widespread exploitation of vulnerable women, exchanging work or work promises against sex. This has been widely covered by the New Humanitarian and the Thomson Reuters Foundation. It is also mentioned in the article that despite existing complaints channel, none of the concerned organizations received any of these complaints. So CRMs need to be accompanied with trust building as well. And I think some other measures needs to be also explored of how to strengthen the whole system. So we have organized several webinars on the CRM in recent months from the Q&A hub as well, focusing on best practices. Given the operational challenges that all the sector was facing, we focused on best practices. So participants can find guidance note and key learnings from the webinar on our website. Thank you. Over to you, dear.
Thank you, Shama. I also see in the chat that our colleague Zainab Mir is also sharing some of the reference documents for us to read. Thank you very much, Zainab, for your sharing. We'll talk about that later. Over to Dr. Faisal. From your, I know that Mercy Malaysia is doing a great thing in your specific country and then globally, of course. So do you have any special approach or methods that you are practicing in maintaining your program accountability? Over to you, Dr. Faisal.
Thank you, dear. Thank you. I must admit that number one, it has been very challenging, especially with regards to medical and health programs with affected populations, especially with patients and patients' families, for example, simply because of logistics issues sometimes. It may sound mundane, but the fact that we have, for example, some quarantine processes, not just for patients who've been confirmed, but also for persons under investigation, yeah, persons under surveillance. I'm sure that's the same in many countries, and perhaps the nomenclature is slightly different, yeah, and of course there are also difficulties in getting people to come out. It is already difficult, like Shama was saying. In the best of circumstances, it is even harder now. Because people are restricted. In Malaysia, for about 3 months, there was also the extra challenge of a very strict movement control order, which helped to bring the numbers down in terms of the pandemic, but severely limited movement. And of course, we can argue again that more things are done online these days. But then again, it depends on who is online and who is able to access online technology, internet, etc., etc. Yeah. So we have since then learned this lesson, and we're trying to do, number one, more on the spot feedback whenever a program, especially a health or medical program, is done, and number two is to connect with the beneficiaries directly after the program through online methods. The one area which we have done fairly well or better is in our mental health and psychosocial support program. That's simply because the nature of the program itself, and because there's direct communication between beneficiaries as well as providers of the aid, of the psychosocial aid. And because, for example, on our helplines, we have a helpline, and registration of at least some form of contact is required. And for our webinars in this program, when they're done in webinar form, again, we are able to trace most of the people who come on board. Therefore, in our mental health and psychosocial support program, the feedback mechanism is a lot better. And we do get both positive feedback as well as complaints better in our mental health and psychosocial support programs. With regards to food and other types of non-medical aid distribution, again, this is where some of the logistics challenge present themselves. So we're trying to improve whereby we not only have to do contact tracing. It's similar to contact tracing of patients and patients' contacts. We also try to do now tracing of beneficiaries who have received aid, and to look and to ask them for their feedback. This is still work in progress. I would say that on the whole, though, even the Ministry of Health in Malaysia has struggled with this, and we are trying to, through our National Disaster Management Agency, trying to put forward a better risk communication for both government as well as non-governmental organizations with regards to the pandemic. And in that risk communication, we would like to incorporate feedback as well as complaints immediately. What's happening now is that the complaints are coming in sporadically, and that's not good because you hear different things different times, and sometimes you miss important ones. So this is what we're trying to do. It is still work in progress with the government, which we hope will find a way together. Thank you.
Thank you, Dr. Faisal. Belinda, do you have something interesting that you would like to share on how Yakum Emergency Unit maintains program accountability? Over to you, Belinda.
Yes, basically, we would like to see in different aspects. And first is on the community-based approach, and I think it has been elaborated nicely by the previous speakers. And basically on our experience in Yakum is that we conduct the COVID-19 programs directly to the community and make sure that community involvement is there, and that we base our intervention based on the local context also. So in that case, we are not going to explore further about this approach. Another approach what I would like to share is on the institutional approach, which is still, I think, is a bigger task for us because it is still ongoing on how we develop our organizational approach to address this the pandemic in the COVID response. So, as I previously mentioned, that modification of the project is key, and we are fortunate that in almost all of our project we can modify it into a COVID-19 response without any problem because we communicated regularly with our donors. So on the modification of the project is what we learned so far is that sometimes in our program we did not anticipate the pandemic as a risk management, as part of the risk management, which will last for indefinite period of time because we may not know how it will end. So therefore, in modifying projects and projecting future project, it is now an imperative also to include the pandemic in its impact. And also at the same time, we are also providing humanitarian assistance in compliance with the health protocol. And also we conducted a remote monitoring mechanism to ensure implementation. But in principle, humanitarian assistances continue to provide a sense of security for staffs and also for beneficiaries, including for the vulnerable groups. And also within the internal organization, we are also thinking about the participation on how we also adhere to the CSS standards on the participation, how the program adjustments in COVID-19 response still pay attention to the principle of participation and use of non-conventional methods that can reach more people. So for example, we will use more online assessment, we will use more remote selection processes during before the distribution of our relief assistances. So I think this is also key in our activities. In a way, it is also an innovation, a new thing for our staffs to do this task. So I would also emphasize the approach that we use is on the remote monitoring, because this is also the part that we would like to maintain during our program implementation. And we have started to use the remote monitoring since the pandemic. And I think this is a good momentum to give a greater role to local partners and also cadres due to the restriction of traveling and the other things. So what we learned through this remote monitoring is that how responsibilities in carrying out the project function can be delegated to the local partners and the local health cadres or the local volunteers while ensuring the capacity building needed. So we also design capacity building session for them as well. And also this is done solely to ensure that the same quality monitoring is reached within the same standard as previously carried out by our own staffs. So we also, during this remote monitoring, we also carry out the satisfaction survey and post-distribution monitoring survey with the help from the village cadres or the health cadres and also volunteers, using the combination of offline and online platform to allow for different groups to join in our post-distribution monitoring surveys. And also with regard to the organizational development, we also think about how to equip the manpower within our organization with the right skills and knowledge, especially in providing assistances during the pandemic. And this is also been a big challenge for our HR division, where they ensure that staffs are able to adapt and work in the adjusted programs, and also acquire new knowledge, such as being proficient in utilizing online platforms to support our work mainly. So it's not only for our staffs, but this is also to our volunteers, especially volunteers from the village communities who work close in close in close engagement with our field officer, especially in the monitoring and the survey process. So in this part, we provide the innovators also sign the code of conduct, which include an integrity part. So we also want to make sure that this is not only our staffs who understand about the code of conduct even during the pandemic, but also our volunteers, especially in the village volunteers. And also, I think this becomes also the momentum for us to set up the long-term institutional commitment. So this is not only for us working in the field, but also the policymakers in our foundation, in our yayasan, on how this momentum can be seen as an opportunity to see in the micro and macro perspective on key policies to what is that? To quality assurance. And I think reaching out to the complaint response mechanism or feedback response mechanism, the principle is still there. So we want to maintain the same quality in terms of providing factual reports, explaining the situation, responding to feedback and complaints, and ensuring access to information for partners and beneficiaries. So basically, we are still doing the feedback response mechanism even during the pandemic. So I think that's all there that I can share to you, and over to you. Thank you.
Thank you, Melinda. I'm taking note on what you have said earlier about having security as a protection to your staff, your volunteers, as well as protection to the communities that you are serving. I think this is a very strong point for us to maintain the accountability during this COVID-19 pandemic situation. Because we tend to think more on the protection to the beneficiaries instead of protecting our staff or our volunteers. Thank you for raising this out. So I'm seeing 3 or 4 questions already, which one of them I think is directed to Dr. Faisal because he mentioned about Malaysia. We will discuss on that later, but let me ask the 3 speakers for the third key question, because COVID-19 pandemic is something that is very first time for everybody, of course, and the world is facing on that together. There's a lot of information that we don't really know if this is really the correct information or not. So in terms of serving your community or dealing with the information that you are having, because you are the frontliners to your community, so how do you experiencing this? How do you countering misinformation, and also we call that as infodemic because there's a lot of information that needs to be shared, but some of them are actual information, but some of them not. So I think I will let the honor to respond to this question to Dr. Faisal. How do you seeing this? How Mercy Malaysia counters misinformation and infodemic during this COVID-19 pandemic situation? Over to you, Dr. Faisal.
Thank you, dear. I would put it very briefly in a few points. Number one is we can't, as I said right at the very beginning, we can't stop the deluge of information that's coming in about the pandemic, both about the virus itself, about the disease, as well as about public health, yeah, and as well as about even governance and funding and politics related to COVID-19. We can't stop this deluge of information. What we need to do, however, is to manage it and to present what are the priorities. So that's number one. That's how we at Mercy Malaysia look at it. And first and foremost, we look at our own information. Our own information has to be correct, has to be accurate, has to be sometimes we have to be a bit more strict with our own information, limited to our sphere of work and our mandate. We try not to talk too much about things that are beyond our mandate. So that's how we keep our information correct. However, if we find that there is some information which is absolutely wrong, then we will look at the context and see. Sometimes Mercy Malaysia does react alone. Sometimes we react together with partners. And there was an occasion in Malaysia when about 3-4 months ago, when some parts of the community, unfortunately, because of pressures and stresses, which we understand, of the pandemic and of the lockdowns, became a bit xenophobic, especially towards refugees for no particular reason, although the refugees themselves have very low rate of infections. But because there was a situation when the migrant workers were harboring quite a significant load of infection, the refugees got the brunt of the xenophobia. Mercy Malaysia then, looking around and looking at how at that particular time in point there was a paralysis of sorts among both the authorities as well as mainstream civil society organizations, we decided together with a couple of our partners to actually come up with a statement to correct that misinformation. Of course, when you do that, you have to be able to also manage sometimes the backlash that comes with it. Yes, but sometimes it is worth it. It is serious enough for us to warrant us to do that. But most of the time we don't go so dramatically. Most of the time we will work with media partners, we will work with the government, with local government if it's a local issue, as well as with the Ministry of Health if it's a national issue, and advise them through our internal channels on why we think they should not be saying this or saying that, and to correct the information. So that's number one. Secondly, we do on our own do information, education, and communication programs on the pandemic. That's part of our response and preparedness cycle. So there we actually go down to the communities. An example of which is a hand washing program in schools, where we then also combine that with some education programs, whereby we don't only teach school children to better use hand washing and use the correct hand washing techniques. We also take the opportunity to actually have information material together at the hand washing kiosks, whereby they get educated on other aspects of the pandemic. So hopefully by then they get the correct information about the pandemic and how to prepare and how to respond better. Last but not least is we also work together with local organizations to correctly disseminate, and as I said earlier on, to correctly disseminate with the right people. And sometimes the right people may not be our own. The right people may be from among our partners. who may have better connectivity with the local community. So that's how we will do it, and we have done it that way. So yeah, thank you very much. Yeah.
Thank you, Dr. Faisal. Since you are touching base upon the education, and also you mentioned earlier about psychosocial and mental health, I see our colleague, namely Novanto Agus, he is asking on the Q&A menu. I think we can go to that. How is the digital learning education for the elementary, junior high school, and senior high school children in the remote areas goes on? He shared his experience in East Malaysia, Sabah and Sarawak. Do the parents, especially mother, facing difficulties on guiding her or his children to follow the virtual education program? How is your strategy facing the issue? So would you like to take on the question, Dr. Faisal?
Okay, there are two steps to that. Number one, of course, Masih Malaysia is not the Ministry of Education, so we can't actually. Yes, there are problems at the moment with, as I believe in any other country, with the education system impacted by the pandemic, and Masih Malaysia does not do mainstream education as one of our programs, but we have partners who do, and there are organizations at the moment who actually provide education programs online to supplement the curriculum that is kind of affected the national curriculum that is, and I can understand if it's in an area where especially internet is not optimal, and even if you pay for it, yeah, and as well as even if it is optimal, of course, then there comes the issue of devices, the issue of compatibility, etc., etc. All these add to the issues, and then will then add on to mental and emotional stress. I guess from our perspective, Masih Malaysia, we then provide the mental health and psychosocial support for that, and there are other organizations that do that as well. But I'm afraid we don't do direct or mainstream education programs. That will have to come through the Ministry of Education, which in Malaysia is very centralized, unless your children are at private schools. So this is a difficult issue, and I'm sure it affects a lot of other people as well, and a lot of other people in other countries as well. Thanks.
Thank you, Dr. Faisal. Sorry for jumping up to the question from the attendees. I would like to go back to Shama on the third key question. How do you counter misinformation and pandemic? Would you like to share some experience on this, Shama? Over to you.
Hello, sorry, I was just having some technological challenge. Yeah. So I think what makes this pandemic different is the sheer quantity of information that is pouring in, particularly online and through social media, at a time when people are particularly feeling scared and vulnerable. And there are so many unknowns even now about the virus and its spread and treatments. So the infodemic is not only defined by misinformation, rumors, conspiracy theories, but also by the sheer volume of information. Some of the information may be true, but not well presented or unclear. So it's confusing for people and at times not very helpful. So I think this has also resulted in harm and loss of life amongst people. And we've seen it, I think, countless times in the news as well, about people ingesting harmful substances. Like even civil societies like the BBC Media Action that have been tracking fake news have found its links to assaults, arsons, and death. And Dr. Faisal mentioned xenophobia. I think it's also played a role in discrimination, where certain communities have been blamed for its spread. We've seen that here in Pakistan and Afghanistan, how returnees have been blamed for its spread, and they have not been treated very well in that respect. So, and I think people belonging to a particular religion also have been under attack in various parts of the region. So I also feel there seems to be like a huge trust deficit amongst people. in the information that's being provided to them. So they do fall victim to rumors and fake news and conspiracy theories. So I think for us, for organizations like us, it's been quite challenging to dispel and keep up with the rumors and the fake news. We've seen already the role of misinformation in Pakistan that's played in our polio eradication campaign. So we feel that correct and trustworthy information, it saves lives. And it's important to track and analyze this information to see what trends are emerging. So at the field level, it was very common for us to come across misinformation like COVID-19 is propaganda by the government to raise funds from foreign countries. It was very common information or news among people that whatever happens, don't go to the hospitals because they'll inject you with something and healthy people will die. People associated their religion or religious practices to being immune from the virus. There was a lot of information circulating about certain herbs or traditional remedies which were actually harmful. Even drugs like opium are being promoted to prevent it or cure it. So we felt like that misinformation in conjunction with people's perception of risks that I was sharing earlier, it makes our work even more challenging. And there are unfortunately certain people within communities also that build on information and people's fear to promote their own interests. So our field team's approach was to provide correct information about the virus and also debunk some of the misinformation. So again, we found involving community structures like the village committees, steering committees, or health committees as an effective way of addressing misinformation. It's important to have advocates or champions, as Dr. Faisal put it, at the community level, especially if it's a village leader, elder, a religious leader, a teacher, or someone people trust, as people listen to them and believe what they say. So having them at the forefront really helped. I think other CSOs and the government also have used radio, television, text messaging to share information and address misinformation. In Pakistan, even when you make a phone call via the mobile, instead of hearing the ringtone, we have to listen to 30, 40 seconds of messaging on COVID-19 now, which is quite frustrating, but at the same time, it's an important way of addressing misinformation. From the Q&A hub perspective, we were able to organize some webinars for other CSOs in the region because we know we've all been struggling with this issue. So in July, we organized a webinar on understanding and handling misinformation to share approaches and experiences for countering and mitigating rumors and misinformation. So we collaborated with the BBC Media Action and First Draft, who have been tracking the kinds of coronavirus content posted online, so that they could identify patterns and trends that could then be shared with newsrooms and other communicators. So they have quite a bit of learning materials available for the public and for journalists and for organizations that work on misinformation. So, I mean, if there's time later in the webinar, I can share some of the interesting perspectives from that webinar. But over to you for the time being.
Thank you, Shama. Yeah, unfortunately, we do have very limited time to dig more on this topic, but it will be interesting to have a separate webinar, I think, to dig more. Over to Melinda. Do you have any experience that you would like to share on how you encountering the misinformation and infodemic?
Yeah, I just want to briefly add things that I think we can share from our experience. That first is that the engagement in the cluster and coordination meetings that we have so far is not only to gather inputs from across multiple sectors on various COVID-19 responses, on identifying gaps and etc. But actually during these occasions, this is also serves as a hub for clarifying things. So the things that need to be shared to the partners and also to the communities as well. So we see that the engagement in the cluster and coordination meetings is also valuable in how we can, mitigate the misinformation that circulating among the community. And also, I think, as previously mentioned, engagement with the media, the local media, I think it's also important. Currently, YEU receives support from UNDP office in Indonesia to conduct a series of online discussion with the aim at better understanding how different parties, different stakeholders carry out different intervention in responding to COVID. We also discuss on how to synergize with each other and share especially share information, and also address misinformation as also. So in this opportunity, we invited stakeholders in series of discussion, which include COVID-19 village task forces from 6 cities, representatives from the hospitals, the representatives from the community health centers, from the sub-district and the village authorities, and also organizations of persons with disabilities and older people. So we invited them in series of webinars to learn on different themes. So for example, I can share you some themes that we already had so far. So on how to do isolation for people with disabilities, managing household waste, how to translate the new normal in everyday life, and also in the organization, awareness session for the hospital related to how hospital can develop into a more inclusive hospital in the future, and how we address misinformation, hoax, mythbuster, and the other things. And the last session ended in the online national seminars with the Ministry of Health regarding the provision of basic services during COVID, and how the information can be shared to further communities. So I think that's Yakung already had in terms on countering the misinformation and in infodemics during this difficult time there. So over to you there. Thank you.
Thank you very much, Melinda. So yeah, all key questions have been answered by the three speakers. We are now moving on to the Q&A. I'm seeing that one of them has already been answered by Shama. Thank you very much, Shama. The first question is very interesting, and I think it will like wrap up this topic actually. So if you would like to answer this, what is the impact on your organization when a part of the accountability is not fulfilled? Do you have any experience that you would like to share? Who would like to go first?
Okay, I'll go first. It's a very interesting question. I was looking at it.
Please.
Yeah, I think for us, we always try and always strive to meet all the accountability principles and standards that we've set for ourselves. But the reality is, I think, everyone may, agree with me that it's not always possible to meet all the standards that we try to hold ourselves to account. But I think the important thing is that we're committed, and we're genuinely committed to fulfilling those, and try to learn from our experiences when we're not able to do them for certain reasons. So I think it's important to set the bar high for ourselves, and then always try to strive to reach the accountability bar that we set for ourselves. So, I mean, for example, we all talked a lot about access today and how difficult it was during the pandemic. And, that is one of our commitments when we talk about accountability. So, I mean, we've all been trying different approaches and strategies. Maybe we enhanced access, but maybe we haven't fully ensured that all the people we wanted to access our information or services, that they all got that, but we do try to do that. Yeah, over to someone else if they want to respond to it.
Thank you, Shama, for taking up the initiative to respond first. Dr. Faisal, you have any experience that you would like to share to respond to the question? Hello, Dr. Faisal? Oh, I think we lost him. Okay. So Belinda, maybe you would like to take the opportunity to answer.
Okay. There, in responding to that question, I think us as a organization will always put ourselves as a learning organizations, and we are not going to be put in a situation that you should do perfectly in certain activities or certain project, but at least as a learning organization, there is space for us to develop what is best for us in what is that in 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 making our approach better, and how we can also provide quality assistance to the community, because sometimes because we also want to what is that learn not only from the textbook, from the standards, from the guidelines, but quite often we learn from what we are doing. So I think this allows us to improve our interventions when we see ourselves as a learning organization. I think that's what I can share about this. Thank you.
Thank you, Melinda. Now I'm seeing Dr. Faisal. Would you like to answer to the question from Humanitarian Partnership, Dr. Faisal? Okay, I think yeah, I think the connection is not working. Okay, then. So let's move on. Unfortunately, we do have a very limited time. 2 hours for discussion of this topic is not really that sufficient, actually, because we do have a lot to share. We do have a lot to learn from each other. And I think we need to also maintain this dialogue within CSOs among these regions to dig up more on the quality and accountability. So before we close this session, so I would like to have every speaker a closing statement. How would you like to highlight 1 or 2 things to maintain the accountability in humanitarian response during COVID-19 pandemic? Over to you, Shama.
Hi, thank you. I can't turn my video on, but anyway. So I think one of the key things that I would suggest is I would relate to the standards, SPHERE, the core humanitarian standard, and other similar standards. But these standards do provide us a very comprehensive framework within which we can ensure greater accountability to the communities. And the second thing I think that we've all emphasized on is having localized approaches, working with local communities. That can really ensure that we are more accountable. But also I think where we can strengthen ourselves is, giving power back to the communities as well. So making sure that they can actually hold us to account. And I think that's where we can strengthen a lot when it comes to accountability. Thanks.
Thank you, Shama, for a very powerful closing statement. Belinda, over to you for your closing statement.
Thank you, Dare. So I think it will relate to the last statement about us as a learning organization. I think this is the key that how we survive so far. And I think Yakum is trying to adapt to changes in the humanitarian response. So we are already familiar with emergency responses in the national or in the regional level. So now how to provide assistances in a not so normal condition is we already done that. But in order to maintain the quality of our humanitarian assistances, we have started to document practices. I think documenting practices on the current COVID responses is also key. It is not for the future purposes, but also for the improvement of our intervention as well. We also aware that the nature of our organization is mostly to provide direct assistances to the community. So in this case, communities are always in the center of our attention and also interventions, and particularly in addressing the vulnerable groups who are also part of the community. We always endeavor to develop our inclusion strategy. And lastly, we believe that accountability is an institutional asset that we continuously try to improve. I think that's all I can share. There, over to you. Thank you.
Thank you, Melinda. So before jumping up to Dr. Faisal's last statement, I'm seeing in Q&A, Shama, you would like to answer a question from Novanto Agus. Please take this opportunity to respond to that.
No, I was trying to respond, but I think I pressed the wrong button. No, I was just saying how, how hard it's been to ensure education for children, especially belonging to rural areas. So in the cities, it's still, schools have been functioning with virtual and distance learning. But for rural areas, it's almost been, there has been no education for the last 8-9 months. Schools just reopened at the end of last month in different stages. In rural areas, how can children engage in distance learning without the technology, without the wireless coverage? They don't have access to those kind of resources. But in our organization, we have stayed in touch with teachers throughout this process and what role they can play in their communities in making sure that some level of education continues. And we've been focusing a lot on preparing them for when children return back to school, how to make sure that the spaces are safe and how they can teach in an environment that doesn't put children to risk of contracting the virus. That's what I wanted to say. Thank you.
Thank you very much for responding to the question. I hope this answer will be satisfied for the attendees who raised this question. Dr. Faisal, are you still here with us? Okay, I think we can connect to him later. Hello, Dr. Faisal. Okay then. Yeah. So thank you very much, everyone in this room, for all the speakers, Shama, and then Belinda, Dr. Faisal, and then also Angelo, who briefly joined us, unfortunately because of the internet connection that he could not rejoin. But we are sure that we will be having wonderful opportunity to talk with him later. And also thank you all for all the attendees that are participating in this webinar. We would like to also invite you all to the last but not least webinar series that we are organizing, which is the 5th webinar that we will be discussing about the impact on the multi-hazard threat towards multi-sectoral humanitarian response. It will be held on 26th of November. So make sure you don't miss this information. Make sure that you guys are participating in this webinar. We will post this invitation or information to the ADRN ICPA HFI mailing list and social media. And thank you for all the participants that I'm already aware that you are always participating in our webinar series. Thank you very much for your support, and thank you also very much for the attendees that are watching in our YouTube and Facebook. And also for the sign interpreters, Mbak Mada and Mbak Ragil. Thank you very much. You guys are doing a great job. So thank you very much, and stay safe, everyone. Have a good day, and see you on the other event as well. For all the panelists, can you open your video, and then we can have a virtual photo group